Hello guys, welcome to the Eat Like Ruby podcast. I am back doing another episode in our fat loss phase series. So if you've just stumbled across the podcast, first of all, welcome. We are stoked to have you here, but we are about 10 episodes into a very intentionally structured series of episodes all about fat loss. So if you have a fat loss goal, I would definitely advise going back to, there's an episode that's called Exactly How to Achieve Fat Loss Part 1. That was basically our starting point. And then every episode between now and then has been very intentionally timed and structured and done in order to navigate everything I think people need to know and understand to set up a successful fat loss phase. So if you can relate to that and you've just walked into this episode, like I said, welcome, we're stoked to have you here, but that would be a really cool starting point. But if you've already worked through those and you're a regular listener and you're ready for what we're going to talk about next, welcome. What we are going to talk about today is weight loss versus fat loss. And we're going to look at setting fat loss and weight loss goals and the things we want to think about there. And we're also going to look a little bit at scale fluctuations. And we touched on a lot of this in our most recent episode about tracking progress. And in that episode, I just spoke about everything I think we really need to know and understand in order to intelligently and successfully track progress when we have a fat loss goal. There's definitely things I think we should be doing and things I think we shouldn't be doing, just so we can actually navigate that in a really intelligent and a really positive way. So definitely listen to the most recent episode if you haven't, because that's going to tie in perfectly with what we're going to talk about here. And there's going to be a couple of little things that come up in this episode that we have touched on in recent episodes, but I think it's important to kind of revisit things. The more we learn, the more we can understand things and kind of start to realize how we can personally navigate them. And I think it's just a lot of crossover. Obviously, when we're setting up a successful fat loss phase, lots of things are going to come up. So we're going to hear some things today that we've touched on before, but it's all going to continue to really tie in together. So the very first thing I want to touch on is, obviously, I'm constantly referring to fat loss, not weight loss. I don't coach on weight loss. I'm not a big advocate of weight loss. Obviously, if people have a big weight loss goal, I can absolutely understand that. But yesterday we spoke about the fact that weight is made up of so many things outside of body composition and outside of body fat and fat loss. So if we're just looking at weight or we're just thinking about weight, it's just not an intelligent way at all to assess body composition progress and fat loss progress. And that kind of brings me straight into my next point, which is, I think it is so important to think about, what is your actual goal? And so often when we ask this, people can respond really quickly with something like, I want to lose 5 kilos, 10 kilos, 20 kilos. Very often it's a numbers-based goal. And that is what I want to look at here, is taking it a step further and going, what is the actual goal? What is the thing that you want to achieve, and / how do you want your life to be different as a result of achieving fat loss? And what I mean by that is, if you do respond really quickly to that question of what is your goal with a numbers-based goal like 5, 10, 20 kilos, etc., really think about, what is it that I want to be different in my life as a result of losing that number or as a result of achieving that number? Because that is your actual goal. And if we look at that, it can be different from person to person, but often it's things like, I want to be in better health, I want to have more confidence, I want to feel more confident in certain outfits or certain situations. People can hone in on little things like, I want to be able to wear shorts, I want to be able to go to the beach, I want to be able to train in a crop top. And I just want to point out, obviously I know that we can absolutely do all these things at any size, but it is very common for people to have a goal of achieving fat loss or weight loss to feel more confident doing those things. So we're not going to get into that convo of body positivity and size and all of those things. That's for a different podcast. That's for a different person. If you've got goals and things you want to achieve in relation to fat loss and body composition, etc., like I've said in recent episodes, I think we can do that in a really positive way, and that's exactly what I'm here for. So coming back to the point of what is the actual goal, it is so important to take that step further than just saying a number or just working towards a number and thinking, what is it that I want to be different or better, etc., in my life as a result of achieving that thing? Because that is the actual goal. The numbers are the middleman. And I've said in recent episodes, we don't actually ever have to take weight ever again. So it's very important to understand that, because so many people can just peg everything on that numbers-based goal, but it's like, the number doesn't actually matter. No one knows, no one cares what you weigh. And if we think about achieving that goal, let's say someone has a 10 kilo weight loss goal. What you're really wanting is to be able to go into any of those situations, like I said before, feeling more confident, feeling like you have better body composition, feeling like you can wear certain outfits, etc. So when you achieve that, you're not going to walk into work or the beach or anything like that and be like, guys, I've lost 10 kilos, I've lost 10 kilos. Like, you're not going to be shouting that to the rooftops. You might tell some of your mates or whatever, but you're not actually going to be walking around notifying people of that. What you're going to be walking around doing is experiencing the benefits of that, aka the better confidence, wearing the outfits, feeling better about certain things. So that is what we're actually working towards. And it's just really important to keep that in mind because, like I said in the most recent episode, numbers are going to fluctuate. And I'm going to talk about that a little bit more in a second. But if numbers are going to fluctuate, we don't want to peg everything on those numbers because on days that they fluctuate, we're going to feel like things aren't working and we're not moving towards that goal. So we need to actually think about that next goal and be like, well, no, if I am getting good habits in place and I'm progressing overall towards my body composition and my fat loss goals, exactly like we spoke about in that recent episode, then I am making progress and I am moving towards feeling better, feeling more confident, being in better health, etc. So anytime I see people just referencing numbers, I'm always going to push and dig that little bit deeper and be like, why do we have the numbers goals? What is it that we're wanting as a result of those numbers? Keep that in mind because numbers are going to do their thing. Numbers are going to fluctuate for so many reasons outside of fat loss. And that comes back to my very first point of the fact that I always talk about fat loss, not weight loss, because weight is going to fluctuate and do its thing. So we want to be really clear on the bigger goal on the other side of that number. Like I said, think about the number like the middleman and really keep in mind that we're working towards fat loss. And I'm going to talk about that a little bit more in a second, not just a weight-based goal. That's very old school. And if you've been used to doing that your whole life, that's totally fine. No shame. I'm never going to judge that because, like I said, that is very old school and people have done that for a really long time. But we understand so much more about body fat and body composition and weight and all of these things now. So it is quite old school. It's quite a narrow-minded way of looking at things, just looking at weight. And again, if you haven't listened to the most recent episode, I would definitely do so because I spoke about the things that I would be more focused on than weight when I have a fat loss goal. And the other little thing I want to touch on here before we get into the fluctuations and the scale weight chat is thinking about what we said in those initial 2 episodes of exactly how to achieve fat loss. We did part 1 and 2. I spoke in those episodes about the fact that we want to focus on action-based goals, not just results-based goals, because action-based goals are what's going to move us towards the result. And I'm going to summarize that really quickly here because we have spoken about it a fair bit. But if we do have a goal that is something like I want to lose 5 kilos, 10 kilos, etc. First of all, do what I just said. Think about actually why, because that is your real goal. But then bring it back and go, okay, that's a results-based goal. That's the result that I'm working towards. That's the desired outcome that I eventually want to get to. We then want to bring that back and go, what actions are required for me to get there? And then we want to set goals, small goals like daily goals, weekly goals, etc., to carry out those actions, knowing that they're the thing that are going to get us to the result. So examples I've used of this before are setting action-based goals like I will get X amount of steps every day. I will monitor my food intake. I will plan my food the night before, or I will plan my food for the week. I will meal prep. I will be organized. I will hit X amount of protein, because those are the things that are within our control. And those are the things that we can decide to do. We can decide to carry out those actions. And if we do carry out those actions on a consistent basis, they're going to be the things that move us towards the result-based goal. So we can absolutely have a results-based goal like fat loss. And again, pull it apart a bit and go, yep, I want to feel more confident. I want to feel XYZ. I want to wear this outfit to this event on this day. I think that can be really positive. If you've got something coming up, maybe in summer or the festive season, etc., and you're thinking, I want to wear this outfit, right? And I want to feel great when I do. That's awesome. I think that's such a cool thing to work towards. So that is a results-based goal. That's the result that I want to get. How am I going to get it? I'm going to carry out the actions required to get me there. And then that comes back to the action-based goals and setting those goals every day or every week, however you want to structure things, but knowing what you need to decide to do and actually carry out and do to move you towards that result. So it's so important to get clear on the actual goal. And then it's so important to differentiate between action-based goals and results-based goals and go, it's really cool to have a results-based goal. That's what I'm working towards. But I am going to work towards it through the action-based goals that are going to get me there. And this is such an interesting topic. Like, I've been talking about this topic for years, and sometimes people don't really take it in. Like, we can talk a lot about the difference between fat loss and weight loss and scale fluctuations, etc. And people can still really just watch the scale. And if you can relate to that, definitely listen to the most recent episode because I spoke about all the reasons why that's just not an intelligent way to monitor a fat loss phase and monitor fat loss progress. But if we tie in that episode with everything I just spoke about, we want to look a little bit more at weight fluctuations and what's actually happening with the scale so we can actually understand why it's not that intelligent to just rely on scale weight when working towards all these goals that we're talking about. So an interesting thing to understand here is that a kilo of body fat is worth about 7,700 calories. And if you don't understand that, think about everything we've spoken about in recent episodes about how, in simple terms, I'm really going to summarize this, but food contains calories, calories are energy, and body fat is stored energy. So I've spoken about that in the early days where we take in a certain amount of calories / energy, our body uses what it needs to, and if there's some left over that it doesn't use, aka there's a surplus of energy, the body moves that into storage. This is how body fat accumulation occurs. So body fat is stored energy. Think about what I just said, where a kilo of body fat is worth 7,700 calories. So to put on a kilo of body fat, we need to have an excess of 7,700 calories come in, meaning the body gets energy / calories coming in. It uses what it needs to towards its daily activities and training and all the things we've spoken about. And it's moving the leftover excess that it doesn't use into storage. To put on a kilo of body fat, it has to move 7,700 calories into storage. And it's really important to understand that because we're going to talk about scale fluctuations in a second. It can be really common to see scale fluctuate by a kilo, right? And we know scale can fluctuate in little numbers and in bigger numbers. But if we think about a fluctuation of a kilo, meaning you might have weighed 70 kilos yesterday and 71 today, if we do not understand nutrition and calories and energy and all of these things, people can see that straight away and freak out thinking it's body fat and I'm not making any progress, I'm going backwards, etc. If we think about the fact that a kilo of body fat is 7,700 calories, when we see a weight fluctuation of 1 kilo, straight away ask yourself, did I eat an excess of 7,700 calories yesterday? If you didn't, then you haven't put on a kilo of body fat. Scientifically impossible. And the thing to note there is it's an excess of 7,700 calories that would have to have come in to move a kilo of body fat into storage. So meaning if a person's maintenance intake was 2,000, then that person would have to eat 9,700 calories to put on a kilo of body fat. And I don't actually like to talk about these numbers too often because there's so many things happening in the body with calories coming in and calories coming out. It's a constant ebb and flow and cycle, and there's so many different things that will contribute to exactly how many calories we use and we burn and we move into storage and we pull out of storage, etc. We never ever want to sit there and nitpick those numbers because A, we can never know those numbers, and B, even if we could, it would literally drive you crazy. So we don't have to monitor every single number that comes in and out. But if we can understand A, roughly what our maintenance intake is, then we can calculate a deficit from there and we can put a moderate deficit in place. And we can understand that if I have a moderate deficit in place, my body's going to pull energy out of storage over time. Body fat is stored energy, so I'm going to progress towards a fat loss goal over time. The reason I'm now dropping these numbers about the 7,700 calories is because if we do see a fluctuation of 1 kilo, we can straight away think, did I eat an excess of 7,000, 8,000 calories yesterday? Probably not. So we can understand that that kilo fluctuation is not a kilo of body fat gain. So then if we look at that and think, okay, well, if the scale did fluctuate by a kilo and it's not a kilo of body fat gain because they didn't eat an extra 8,000 calories, what is it? There's so many things that will contribute to our actual weight and our weight for the day. If we think about just basic human functions of things like digestion and going to the bathroom, etc., every time we weigh in, those things are going to be sitting in like a little bit of a different position. When did we most recently go to the bathroom? Do we have a full bladder? Do we have a full bowel? Are they empty? Are they kind of empty? Like that's always going to be a little bit different. So that's going to be one factor. But then we can look at so many other factors like fluid levels in the body that can be affected by things like sodium intake and carbohydrate intake. And again, we never want to kind of sit there and nitpick these things because A, we can't nitpick them, and B, if we could, it would drive us crazy. But if we do have things like an increased carb intake come in or an increased sodium intake come in, these things can lead us to holding more fluid in the body in the form of things like muscle glycogen. So muscle glycogen in simple terms is like fluid in the muscle, carbohydrates stored in the muscle. Really? And I'm not going to get into that here, but if we just think about that, that has nothing to do with body fat. So if we have days that do just have a bit of a higher carb intake or a higher sodium intake compared to our normal days or the days before it, etc., it can lead to temporary spikes or temporary fluctuations on the scale because of those things like fluid levels, muscle glycogen, etc., that have absolutely nothing to do with body composition and body fat. And if we think about that happening at the same time as digestion and bowel movements, bladder movements, etc., we've now got a fair few factors that are contributing to exactly what we're going to weigh that day that, again, have nothing to do with body fat. And then if we look at women specifically for a second that are moving through monthly cycles, we know that at different times of the month, obviously the body is doing very different things. And I think pretty much every woman that's had a consistent monthly cycle can probably relate to having different times of the month where things increase and they decrease, right? And that's due to a lot of other factors as well. And again, I don't want to get too deep into these individual topics, so we'll be here all day. But if we can understand that we've literally got digestion, going to the toilet, time of the month, sodium, carb intake, even just food mass sitting in the stomach, there's so many factors happening in the body and contributing to the body and the weight of the body at all times that, again, have nothing to do with body fat. So if we are just looking at the scale to monitor body fat progress, it's not going to tell us that. And that's why I said in the most recent episode that it's a very unintelligent way to monitor fat loss progress, because there's so much happening there that's nothing to do with fat loss. And if we piece all this together for a second, if we actually do have an effective deficit in place and fat loss is occurring, while the body is also going through all those things I just mentioned, we might find ourselves in a position where body fat levels are actually dropping, like fat loss is occurring, but then those other things are having their ebbs and flows. So you could have successful fat loss happening, but you could also just be having a time of the month that you personally see a weight increase, and you could also have something happening with digestion. Maybe you haven't been to the toilet yet. So those things are going to pull the scale up. Your body fat dropping is going to pull it down. But when we jump on the scale and we just see one number, maybe it was the same number that we saw yesterday or last week, etc., but body fat levels could actually be down. Those other things could be pulling it up. So the body composition is changing and is progressing in the direction that we want to go, even though weight isn't reflecting that on that day, which again is just why I advise not just using scale weight to monitor fat loss progress, because it's telling us so many other things and it's not actually telling us fat loss progress. We can't get on that scale and go, how much fat did I lose? And as a little bit of a side note, I'm definitely not going to get into this here, but things like scales and body fat scans, etc., that can apparently, quote, tell us our body fat percentage and progress are very, very inaccurate. And that's definitely a combo for another day. But those things are hugely inaccurate, and they usually look at a lot of fluid levels. Like, they depend on fluid levels. And like we just spoke about, fluid levels are made up of so many things that have nothing to do with body fat. So I never advise people to use those scans. I probably will do an episode about that shortly, but I never advise using scans or scales that are giving body fat numbers just because we know they're not accurate. And again, let's just tie that back to what I said before. Even if they were accurate, those numbers are dropping. Remember that the numbers are the middleman. We don't actually really care what those numbers are. We care about what's going to happen in our life and with our health and our body composition, etc., as a result of numbers dropping. But if we come back to just normal weight fluctuations using a normal scale, so often people are doing this on a really regular basis and often really pegging a lot of their hopes or their mood and everything on this number. But then we really need to understand the number is affected by so many things outside of fat loss and body comp progress, etc. So it actually doesn't make sense to be pegging all of our hopes on that and pegging our mood especially on that. And like I said in that most recent episode, if scale weight is actually affecting your mood, piss it off, get rid of it. And use things like measurements, pics, etc., because they're going to actually show you if your body comp is progressing over time. And that kind of brings me to my last little point. Like I said in that recent episode, if you do want to use scale weight as one form of assessment in your fat loss phase, I would absolutely make sure you've got other forms of assessment in place. If we think about everything we've spoken about in these last 2 episodes, it does not make sense to just watch scale weight. So I would definitely make sure you've got other forms of assessment in place. And then if you're going to use the scale alongside those, think about what we just said, where fat loss can be occurring over time, but we're still going to have day-to-day fluctuations because of other factors outside of it. And this is why I always say we want to watch the overall trend with these things over time, not overnight. If we think about overnight, we can literally have those spikes from so many things. So the day-to-day number on the scale is going to fluctuate because of all of these factors. But if we have fat loss occurring gradually and moderately in the background and on a clear trajectory over time, what will happen is we're going to have day-to-day fluctuations on the scale, but the fluctuations and the range that we're fluctuating in is going to gradually come down over time. So you might be sitting around like 80 kilos. And if you're taking weight consistently, you might see it double into the 79s. It might bounce back up to the 80s, down into the 79s, low 79s. We might start to see some 78s. We might come back up to the 79s, back into the 78s, mid 78s, low 78s, back to the mids. Then we see some 77s. And this is happening over weeks, and obviously over months, we start to see even more progress. And if we think about what's going on here, if fat loss is occurring, then the amount of body fat that we're holding is reducing. So the amount of body fat that we have that's contributing to our weight is coming down over time. We've still got day-to-day fluctuations happening. So we are kind of bouncing from low 79s to mid 79s and back and forth, etc. But then, like I said, we start to bounce in the 78s and then we bounce in the 77s. And obviously you can apply this to wherever you personally weigh in. But those little bounces back and forth are happening because of all those other factors we spoke about. That gradual trend over time is the fat loss occurring. So if we think about this as a visual, let's imagine we've got a graph that's like 3 months. If we were just looking at fat loss, if we have an effective calorie deficit in place, if we're just looking at fat loss, we're going to have a clear diagonal line coming down, right? But then if we're looking at body weight fluctuations and all the things that are causing those, they're going to be those constant zigzags, right? You're going to have like zigzag, 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 just going straight up and down, because it's like sodium and carbs were down, then they were up, and then time of the month happened and that went up and then that went away, so that came down. So it literally is just little squiggles, little zigzags. What we want to think about is slapping these two together. So we have the diagonal overall trend of fat loss happening. It is trending down, but there's day-to-day fluctuations happening alongside that. So what happens here, and most people can probably relate to this when you've had a successful fat loss phase, you've got a graph, or a weight loss graph, that has a lot of little zigzags in it. But if you look at the first point and then you look at the most recent point, there's a clear downwards trend. The downwards trend is the fat loss. All of those little zigzags are the other things that are contributing to weight while that fat loss is occurring. So if we summarize these last 2 episodes and we really just start to think about effective, intelligent ways to track our progress, we want to make sure we're doing things outside of scale weight, because there's so much else affecting scale weight. It's not an intelligent thing to look at on its own. So we want to make sure we're actually monitoring body composition in the form of peaks and or measurements. Ideally, I think both, unless there's a reason not to. We want to think, if we have a numbers-based goal, we want to dig a little deeper and go, what actually is it that I want as a result of achieving that numbers-based goal? The confidence, the health, the body comp, wearing the outfits, going to the events, etc. Have a think about what that is for you, and remember that that is the goal. The numbers are the middleman. Do not have a numbers-based goal. If you take nothing else from me, do not have a numbers-based goal. Numbers are the middleman. Remember that weight's going to fluctuate because of a lot of things outside of body fat. So we never want to look at day-to-day fluctuations. We never want to look at, what did I weigh yesterday? What did I weigh today? If we do want to use weight as part of our assessment method in a fat loss phase, we want to make sure we're collecting it pretty regularly so we can actually watch the overall trend. Like I said, you're going to have a lot of bounces, a lot of zigzags, but if you're taking it consistently and you step back and you can look over that graph, you can see as those zigzags occur, is there an overall trend happening with those zigzags, aka that downwards trend, etc.? That's what we want to look at. So we want to make sure we're collecting enough data to actually look at that. And we want to understand things like the fact that a kilo of body fat is worth 7,700 calories. So unless you literally eat 8,000 or 9,000 calories in a day, if we see a 1 kilo fluctuation, it's occurring because of a lot of things outside of body fat. It is not a kilo of body fat gained overnight. So definitely take all those things on board. Listen to that most recent episode if you haven't. Listen to this one again if you need to, and make sure you've got effective, intelligent forms of assessment in place to monitor your fat loss phase anytime you go into one. And remember that when we're in the early stages of a fat loss phase, we just want to use tracking progress as a form of data collection. We're not assessing progress. We're not deeming things working or not working. We're tracking progress. So we're collecting the data, we're collecting the weigh-ins, we're taking the measurements, we're taking the pictures, we're getting enough information so that when we've been consistently adhering to nutrition protocols for long enough, we can step back and go, okay, cool, I've been hitting this thing, I've been nailing this thing. I've got a lot of data here to look at and see how it's working for me and know if I need to adjust anything. So we're not looking at it day to day to see if it's working. We're collecting the data so when the time comes, you can actually step back and assess it in a really intelligent way and continue progressing towards your fat loss goals. That is all from me today. Like always, guys, if you got something out of the episode, take a screenshot, chuck it on your Instagram story, tag eat_like_Ruby, especially if you've got like an annoying friend that's always talking about weight. Just chuck it on your story and like hope that they see it and maybe they'll stop crapping on about weight, because like I said, that is such an old school way to think about things. So we want to initiate that change. We want to get this info out to people. Help me, help you, help other people. Chuck it on your stories and I will be back very soon. Thanks, guys. The Eat Like Ruby podcast is not a substitute for professional medical or dietary advice. The advice given in this episode is general in nature and should not be used to treat any medical conditions, health conditions, illnesses, injuries, and/or any nutrition-related conditions, deficiencies, or similar. This podcast is not to be used as or in place of medical advice or dietary advice. Please consult your healthcare professional before implementing any of the advice, information, or protocols discussed in this episode.